Hello, this is Brian Lofton, and I'd like to talk to you a little bit about the vagus nerve, the 10th cranial nerve, sometimes known as the pneumogastric nerve. Now, the last few years, there's been a lot of talk about this kind of a mystical, otherworldliness quality about the vagus nerve, and people are assigning all kinds of uh, capabilities, properties, mysticisms, and legends even around the vagus nerve. In fact, I think despite the books that have been written about it, polyvagal theory and trauma and the vagus nerve, we ought to perhaps explore the mythological reverence that seems to be surrounding this otherwise simple structure in the body. But it's actually not quite so simple. The cranial nerve is the 10th cranial nerve, and its fibers do go through the fasciculi of the medulla oblongata, which is, you can't see it of course, but it's deeper in here. Comes out of the skull through a small hole called the jugular foramen, and it shares that hole with the carotid artery, the jugular vein, and also the accessory nerve. And so as it comes out, it comes through down into the chest cavity. It splits. It has two nerve fibers. They do different things, but the right one goes down deep down below, way below the sternum, and then also on the other side. And one of the things that it does, and it gets its name vagus, which means wanderer, because the nerve wanders and meanders through the body, and it innervates the deeper viscera, the organs of the body, especially the sinoatrial node of the heart, which is the pacemaker of the heart. So it has a lot to do with the heart space, the heartbeat. And of course, the vagus nerve is also epically involved with the organs of digestion, and even wanders down in women down to the cervix. So, cranial work, vagus nerve, is their relationship? What is vagal tone? What is the potential for the vagus nerve, which seems to have this following that's probably not unlike the mystical qualities that seem to surround the pineal gland. So, in my understanding, the way that I work with the vagus nerve is very important in our parasympathetic response. We can't digest our food properly unless we're properly relaxed. Also, anything that it has to do with the parasympathetic state, the rest and relax response, is caught up with the vagal tone. When we work in any style of body work, anything that's relaxing, anything that's nourishing to the body will calm the vagus nerve and also simultaneously stimulate it, because as it is the mechanism for rest and relax, and also to stimulate digestion, to make sure the heart is doing what it's supposed to be doing. It is empowered to do its job better when we have deeply nourishing work. So you can have that happen with massage therapy. You can have it happen with acupuncture. You can have it happen with Rolfing or any kind of modality. Cranial work in particular, because of its ability to work largely through the parasympathetic medium, that vagus nerve, whether it's actually being attended to intentionally or not, it is functioning in the realm that it likes to function in, which is calm, stillness. That is the ideal. So the vagus nerve is being worked indirectly just by having cranial work performed for someone. But more than that, we can actually work directly with the jugular foramen, with the occiput, with the temporal bones, and any of the structures that may be affecting that, and certainly the muscles too. And the jaw plays a big role in this. But we can encourage the soft tissue, the flexibility that is inherent in the system at the jugular foramen to open somewhat. We can speak to the vagus nerve. We can speak then to the organs through it by opening its home, its little shell, so that it can kind of play a little bit, so that it doesn't have as much pressure on it perhaps confusing some of the nerve impulses to and from the brain. So when we work, particularly in this area in here, when we work with the jaw, when we work with the temporal bones, which are always somewhat troublemakers when they're distressed, we are impacting the vagus nerve. And two, because the vagus nerve is this intelligent system, it's part of the intelligent nervous system of the body, it's kind of a two-way street. Or in the vagus's nerve, it's kind of a three-way street or a four-way street. We can impact the brain by working with the digestion. We can impact the brain, we can impact the parasympathetic response by working with the lungs. That's why by focusing on our breathing, it can calm us down. We can work with the vagus nerve by working with the digestion. We can work with the mesentery, which is this incredible collection of nerve fibers that surround the small intestines. And we can speak to it even, if you will, with our thoughts, with our intention, to settle the whole person. It's a great tree. It's like an upside down tree, the way it comes out of the skull, down into the body, into the trunk, and branches out. It looks very much like an upside down tree, and it's simply beautiful. I've actually seen it in labs that I've done with Gil Hadley. I've seen a few of them, and there's a certain reverence that I've felt whenever I have seen it and touched it. It's kind of a flatter nerve that comes down, kind of like a fettuccine almost, but even thinner than that. For me personally, working with it, I would say that I have experienced some moments of I'm not really sure if words really do it justice. It's like working with the heart, or working with a newborn baby, or working with anything that goes above and beyond our ability to subjectify it into this, that, the other thing. It does have a mystical quality. I've sort of seen it in the past as sort of like a spiritual antenna. That gut response, that I know what I know, and I've got a gut sense about this, or like something's just telling me that this isn't right, or something is telling me, conversely, I should do that. Something is good for me, and I know. Or that girl looking at me is making me blush, and I feel it here. I have butterflies in my stomach. That's the vagus nerve. And that vagus nerve is very useful for cranial practitioners too, to be able to get a bead on our clients, to get a bead on ourselves, to know how we feel, what we feel. And I think that's probably the best way of looking at the vagus nerve is, how do we feel what we feel? Why do we feel what we feel? Can we access and listen to that tree of life that's telling these organs in this body what to do, but is also nourishing the information down from the brain, what we think, what we feel, down to our body, and then we get this feedback loop. The body then tells the brain, oh, this is how I'm doing. And I think all of that is really to do with the vagus nerve. And so when we talk about polyvagal theory, that's a whole nother ball game that deals more with psychology, trauma recovery. And vagal tone is another term. For me, that's rather arbitrary. I sort of see the vagus nerve as really just part of the whole, that it really is. It's not something that I separate out and think, oh, I'm going to work with the vagus nerve now. I just don't think like that. It's the vagus nerve is the person. It is the person's ability to feel themselves. It is the person's ability to process, to consume, to know what they're digesting physically, emotionally, spiritually, socially. So the vagus nerve, the tone of the vagus nerve is really set by the parasympathetic response and our ability to soften into that. So it's not tone in the sense of muscle tone, it's the tone of life. It's the tone of the stream of living.